You are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Hello, and thanks for tuning in to another episode of Extracting Wisdom. I'm your host, Brandon Evert, and today we are talking about the national board exams with our guest, Trevor West. Trevor is a D2. Is that correct? Are you D? Okay. D2 at the Ohio State University College of Dentistry. He has an awesome YouTube channel that provides excellent content for both pre-dental and dental students. So please go and check that out. And Trevor has actually just finished and passed his board exam. So we're going to be talking about that and his approach to the boards. So Trevor, congratulations and thanks for being on the show, man.
Hey, thanks. I'm excited to do this. I know we've been trying to match up our schedules. I'm glad we finally get to do it now.
Yeah, absolutely. It's been crazy busy, as any dental student knows. It's really tough, but this episode's perfect timing actually, since you're coming off of boards right now, and that's what I really wanted to talk to you about today. So, but before we get into that, I also like asking all of my guests, what made you decide to go into dentistry? What was your why?
Yeah, so my why, if anyone's out there is about to apply, you're going to have to answer this question a million times on all your interviews. So it's really good to just nail this question down. And it's been 2 years since I've had to give it, so I might be a little rusty. But for me, I grew up in my dad. So I'm from Florida originally, and my dad has a construction company. He builds swimming pools.
Okay.
And so over the summers, I would work in the Florida heat in a swimming pool, no water. It was miserable. And he always told me, I've been able to make a good living for our family like this, but it's been incredibly hard on my body. Like, if you can avoid it, use your brain. And so I kind of had that mentality going into undergrad, and I really fell in love with my anatomy class. And so I decided, after realizing that the human body is something I want to focus on in life, it was either medical school or dental school, right?
Right.
And then I started shadowing, and to me, it was the laid back atmosphere of most of the dental practices that I went to, and the entrepreneurship side of dentistry that you don't necessarily get as a MD doctor and working for a hospital. You're almost like an employee for them. And not that that's a bad thing. It's just, I kind of wanted a little bit more control over my life and schedule. And I really liked that, the business aspect of it too.
Yeah, absolutely. That's a great answer. And that's, very similar to me. I kind of originally I wanted to be pre-med because in high school, I took an anatomy class. We actually did some cadaver work and stuff like that in high school. And I loved it. And I told my doctor that when I was in for a physical for baseball, that I wanted to be a doctor and be a surgeon. And he started banging his head against the wall. And he's like, okay, he's like, before I talk you out of medicine, he's like, medicine's not bad. And I don't want to, stray you away from it. But he said, go check out dentistry first before you make any decisions, just to see how you like it. And just like you said, the freedom, the flexibility, and one thing that I always saw is that, as a doctor, you're either just the radiologist, you're just taking x-rays, you're just doing surgeries. But as a dentist, you're doing all of that, and you get to see that full transition of your patient from, beginning to end, which I think is really, really cool.
Yeah. Dentistry is such a unique field, because you have the option to go completely into the business side, where honestly, you might not do cavity filling for years if you own a bunch of practices. And like, if you want to, people don't really like to talk about this, but like, if the money in dentistry is in the business side. If you own multiple practices, you're going to be making bank. But it's just kind of crazy to me that the field, we have that option. We're going to school for 4 years to learn how to use our hands to make money, but you can kind of completely go away from that. And it's just it's just awesome how broad our future career is.
Yeah, absolutely. There's so many avenues that you could go. And is that something you want to end up doing, is own your own practice or multiple practices?
So if all goes well, I'm planning on taking the CBSE in August, which is a big test I have to take to get into oral surgery residency.
Oh,
And
awesome.
so hopefully after school, or after I finish at OSU, I match into a residency program. And honestly, I think with oral surgery, I don't think I've owned multiple practices. I kind of just I want to own my own practice, but just just do procedures and make my money that way.
Awesome, dude. That's awesome.
Yeah.
So I don't know if our listeners know, but you have a YouTube channel that you started.
Yep.
And it's really great. I've been following it for a while, and your Instagram too.
Thanks.
And for everybody listening, it's Trevor West DDS. So go check that out. What made you want to start that channel?
So, kind of when I was in that phase where I was figuring out whether I wanted to go to medical school or dental school, I was trying to see, I guess it was a lack of confidence. I didn't know if I could do med school. I mean, not that dental school is easier than med school, but just kind of in my own mind, I thought it was. And undergrad, I didn't have exposure to either. And so I was like, man, I want to find out what school is like to see if I feel like I'm competitive with the people who are in each of those schools. And there wasn't really anything out there. And so I figured that I think, so Brittany Watu, she was probably one of the OGs on YouTube. And so I watched all of her stuff. And now I think Laura Smiles has a really good channel as well. There's some other ones out there, but anyways, I wanted to be that resource for any potential pre-dent that was out there looking for stuff. And then I also thought it would be cool, for me later on, years down the road, to be able to look back on my experience, because obviously, you know how hard dental school is. It's life changing, and I want to be able to remember all of these struggles that I'm going through that hopefully eventually I can overcome, and kind of see my transformation into a doctor, basically.
Yeah, that's awesome. And that's kind of the inspiration for this podcast too. I was lucky to be a guest host on one of the bigger dental podcasts, but after I finished that, I'm like, that's very interesting. There's all these podcasts talking about, practice ownership and procedures and stuff like that. And obviously I'm not a doctor yet, so I can't talk about that. But one thing that there's kind of a gap between is getting into dental school and tips on getting through dental school and documenting my journey as well. And that's kind of how this podcast was born. So just similar things, but two different formats, which is, it's really neat.
Yeah. And another thing in high school, one of my favorite classes was TV production. And I originally took it because I could make it be my first and second period, and I could sleep in. I didn't have to go to school. But I ended up liking the editing and videos and stuff. And so I try to I just like the whole creation process of the videos too. Absolutely.
It's very cool. So again, everybody, please go check it out. He has some great content on there, and he talks about how he studied for boards and what's your most recent video? Your lab work, right?
Yeah. So I feel like this semester I'm going to try to get a lot more videos focusing on the lab work. There's only so many times that people want to hear me. Oh, I'm studying for this test. I'm studying for this quiz. So I'm going to try to bring the camera in a lot to lab, because this is our last semester of classes before we get into clinic.
Right.
And it's really lab heavy in itself. So I think that's going to be what these next few videos are on.
Very cool. Well, I'm looking forward to watching them. That's awesome.
Thanks.
So another thing on your Instagram profile is you talk about, you have this company called Fine Balance. It's like an apparel company. So tell us a little bit about that and what it represents.
Yeah, for sure. So another thing that made me get into the whole YouTube space is I watch a ton of YouTubers. Most of them are fitness guys. I love to work out, kind of that all wraps into the whole Fine Balance company, what it kind of represents. But these guys, they're young, our age, and they videotape themselves, working out, not doing anything life changing, and then they start these clothing companies that are, I'm not kidding you, make like millions of dollars. Like
right.
Super young, driving like Lamborghinis and stuff. And luckily, the few I follow, like they're really good guys, like they're good people, and they try to give back. And I was
Right.
like, well, I feel like I've had a lot of education. I kind of know my way around the camera. I feel like I can do the same thing with, and help people in dentistry. So fine balance is all about, trying to make it through school and not hate your life. So finding balance between school and, you as a person, your personal life, whether that's friends or the gym for me personally is what it's mostly about. Or whatever your hobby is, I think you can do very well in dental school and still have, your life outside of school. And so I came up with a design and put it, got some t-shirts that I really like to wear myself. And every shirt that I sell, I donate part of that to a foundation that organizes cleft palate surgeries for kids who can't afford them.
Wow. I didn't know that. That's really cool.
Yeah. Mm-hmm. And honestly, I could do a lot better job of like promoting it and kind of like getting the word out there, but I'm so busy with school. It's hard enough to, make videos all the time. But anyway, it's a work in progress. But yeah, so our symbol, the middle balance or the middle A in balance is, shaped a certain way. It represents a cleft palate. And so, through anatomy, I mean, you learn that there's certain processes that don't fuse together, and that's what happens during embryology to form a cleft palate. But so I think it's just a cool way to raise awareness about how life-changing that these procedures can be, and how I think it only costs $240 to fund an entire surgery for a kid that will literally change their life forever. And so it's just a way that I want to give back, even if throughout the whole thing I only end up donating a little bit. I think that's worth it for me.
Yeah, right. That's awesome. And it's a good reminder too to find balance, because sometimes, especially if you're a dental student or pre-dental student, it's so hard to balance school, significant others, family, it's so hard. So that's really cool that you're doing that. I love that idea.
Thank you. And yeah, it's just something that goes for when you're in school, and then, when we're out of school, eventually, you have to find a balance between work and family. And so it's kind of something, I feel like it's a theme that is never really going to go away.
Yeah, absolutely. I totally agree. So what I really wanted to talk to you about is your board exams. Obviously, one of the most stressful parts of dental school is probably studying for these exams. So what I want to talk about is, how did you study for them, and were the questions that were asked, was it what you expected it to be?
So I'll start with the kind of the breakdown of how I studied, and then remind me if I forget any points that you want me to talk about.
Sure.
But so I made a whole video, kind of going through the whole process of what I did. But we had the option of, you can take this test whenever you want. So if you want to take it during a Christmas break or whatever break you want, you can do that. I think you just have to get it done before you start clinic.
Okay.
So I decided to finish finals this in early December, just do nothing but studying for 2 weeks, and then take it right before Christmas, so that I had the rest of my break to just kind of mentally relax from fall was our most difficult semester, T2 fall was. And then I just wanted to keep all my study habits going and grind out for 2 more weeks, and then hopefully take it and pass. So that's what I did. I finished finals on Friday, and I gave myself 13 days. I took it on the 21st of December.
Okay.
And so I said I had 13 days total. I gave myself 11 days to get through all the material a single time. And then my last 2 days were going to be nothing but peer review.
Okay.
So I could kind of fix any or strengthen any of the weak parts that I thought I had. And so after I finished finals that Friday, that Saturday I was supposed to start studying, and I just couldn't do it. And so I just watched Netflix all day. So my 13 days got cut down to 12, but I mean, it worked out in the end. But anyways, there are 4 subjects. Let's see if I can remember these. And I'm going to list these in importance of what I think like the best way to study. You want to spend the most time with dental anatomy.
Okay.
That's like a huge one. Tons of questions are from there. And those are probably the easiest questions to get right because it's like basically a fact and that's all you have to memorize, right?
Right.
So dental anatomy and then anatomy in general, but 99% of that is head and neck focus.
Of course, right.
So knowing, where the paths of all the nerves, blood vessels, arteries, veins, and so all that kind of stuff.
Right.
That's probably the second most important thing. And then they have pathology and immunology kind of combined.
Okay.
And microbiology.
Okay.
Did I say that twice?
No, I think so. Is there pharmacology on it too?
No. Thank goodness there's no pharm.
Okay.
I have that class right now this semester, but no, there kind of was, but like one or two questions, I think.
Okay.
So I didn't focus at all on that.
Got it. And so
okay. So go ahead.
I was just say, so how did you approach it? What was your 13-day studying? Did you do like flashcards? Did you what was your kind of method?
Yeah. So I used two study methods. I used the dental decks. Kind of everyone knows what those are. If you don't, just Google it and you'll be able to bring them up. It's just a huge stack of flashcards that are broken up into each of those 4 sections.
Okay.
So I knew I wanted to spend 11 days studying. So for like that whole entire dental anatomy stack, I broke it up into 11 small sections, and I would do one of those little stacks each day. And so
okay.
I split each of those 4 big categories up into those 11 stacks, and for one day, I would do one little stack of each of those topics. So every day I was getting exposed to all different types of questions rather than just spending one day on solely dental anatomy. I felt like I would have forgotten a lot of the facts that I memorized when I had spent a week without looking at any type of question.
Okay.
So I would wake up about 8:30. Go through my stack of flashcards for the day, and that usually would last till about 11:30, and I would go to the gym, probably take a 2-hour break, come back, watch a little bit of YouTube, and then go back to the library and keep studying. I would finish my flashcards if I didn't, and then the second resource that I used was the Dental Board's Mastery app. So if you just type in dentalboardsmastery.com, it should bring up a website. I think it's a paid subscription, but it is a million times worth however much it is. That one, if I could go back, I would focus a lot more using all those questions. It's a word bank or a question bank of around 1,200 questions in all of the different subjects, and you answer the question, and if you got it wrong right, it would give you this long, detailed explanation underneath with like pictures and pretty much everything that you would need to know about the correct answer, and also a lot about the wrong answers, so you understand why those other answers aren't correct. And I think that's a huge point that a lot of people don't do, is if they get a question right, they won't look at the other answers on there. But that Mastery app and the dental decks put the wrong answers on that card for a specific purpose, because they want you to know and understand those points as well.
Awesome. That's really helpful information, and congratulations that you passed. That's awesome. I'm sure that's a huge sigh of relief for you now that it's over.
Yeah. So I found out I was at home and I was fishing with my dad, and my buddy calls me that I studied with every single day. We'd go to the library together, and he called me, and I just dropped my rod right there, and I had to check my phone, and luckily I passed. It was it's like one of the best feelings ever to be done with that.
I bet. That's awesome. Now, one thing that's interesting, I don't know if you've heard about this, but my dental class is going to be the first class to take the integrated board exam. Have you heard anything about that?
Mm-hmm. So I posted an Instagram thing saying that I passed and everything, and someone commented on that picture about that, and I hadn't even heard anything whatsoever about it, and I looked up a little bit about it. And I guess you guys are able to combine part one. So there's two parts of dental boards. Part
Right.
one is like what everyone else up until you guys, I guess. Part one, which is mostly all just science related stuff, and I guess part two is more like, I think it's hand skills part and like more patient oriented questions, stuff like that. But you guys have the option of taking both part one and part two at the same time. And if you have the option, personally, I would want to get both of those out of the way at the same time. So that's what I would do. I would try to crank it out and just only take one test as opposed to two, because they're both stressful. So if you can only limit that stress to a couple weeks rather than two, then I think that'd definitely be the way to go. But that is the extent of my knowledge. I don't think I know anything else helpful about it.
Got it. Yeah. My class had a meeting, was it last week? I think it was last week, about kind of the format of what it was. And it's pretty interesting. Each kind of question has an associated like patient box. So it's almost like axiom notes on the patient, like what medications they're on, like what they're presenting to the clinic with. And they have all these kind of scenarios, and then they ask these multiple choice questions. Like some of them will be like pharmacology and drug interactions, or what they're presenting with, what could be the diagnosis, or they could give you a radiograph and, ask you questions about that. But then it's integrating. You have to know the science behind all of that in order to answer these questions. So it's going to be very interesting to see how that test is going to go. I don't have to take it till my third year, D3. I think the same time that you would take your part two is when we would take the integrated board exam. So I didn't know if you knew anything about it, but it should be pretty interesting.
Yeah. So there are, for anyone taking just that part one, every section actually has what they call like, I think testlet things. And it's basically, you're presented with a patient and they have almost their chart. I didn't see any, well, honestly, I think they did have a couple radiographs, but it lists like their the patient's chief complaint and the medications they're taking and why they're in there. And I was completely blindsided by those things. I just didn't know those were coming my way. And so that was kind of like, oh man, I really hope I got those right, because I didn't practice those at all. But there were a little bit of farm integration. Some of the questions were about how the medications worked, but so I think that sounds like a way better deal than having to study two separate times. Yeah,
absolutely. And I think it's more applicable too, because it's kind of relating all the science that you've been learning to a clinical setting. So that'll be interesting. And when I start studying for that, I'll probably do some videos or podcasts on that. But
I'm sure, I think people are probably going to like need that, because since it's something new, there's not going to be as many resources out there. I mean, luckily for me, there's so many different study resources that I can use for boards. I think another big resource is called Boards and Beyond, that I didn't use this personally, but a lot of my classmates did. And it was almost like a video lecture series. So if that's kind of more your style of learning rather than teaching yourself, because the way I did it, I just was reviewing myself. If I got a question wrong, I'd have to Google whatever topic it was myself, and so and learn it that way and figure out how to memorize it. But if you don't like that, or you don't like making up basically your own study schedule, I think a Boards and Beyond type study program would be the way to go. Right.
Interesting. Well, that's great. And I'm sure those study materials would probably be just as helpful on this integrated board, because you're going to need all that knowledge anyway. It's just a matter of how you apply it. But yeah, that's awesome. That's awesome. So I do have a couple other questions for you, non-board related, because this is something that my class is going through now is, so first of all, when you're doing, we're just doing our very first occlusal preparations and amalgam restorations. What burrs do you like to use for your preps? And, do you have any tips on shaping amalgam?
Yeah. Okay. So for the prep part, I use 330.
Okay.
Do you guys use 330s?
We use a 329, which is it's similar to a 330, but it's called like a 329 Midwest version. So that the sides are actually tapered already, so you can kind of get some of that taper in. But
Yeah.
they're
Okay.
similar. They're similar.
Okay. Cool. Yeah. So I mean, I use a 330 for all the occlusal, and I actually like. Do you guys use air-driven handpieces or electric?
I'm pretty sure they're air driven.
Okay, so that's what ours are, but are the incoming class, or I guess the class right below us, they all got electric handpieces,
Oh,
and
interesting.
they're sweet. You can control the RPM, so like you don't have to switch back and forth between high speed and low speed. All you do
Okay.
is press a button, and it drops the RPMs, and it like is since it's electric, it has like infinity torque, and so your burr never like stops. So you can keep it. You could literally sit there and have it on like 3 RPM, and it wouldn't stop. So you could smooth it as much as you want to. But anyways, um, so I actually don't ever use my slow speed. I think when I got it, my slow speed was broken all my first year, and so like I just learned how to smooth the floor and everything with my high speed.
That's how I am
And I
too.
think yeah. I for some reason I can just get like a glassy floor with a 330 and my high speed rather than my slow speed. But I think yeah. So the way I got a lot better at hand skills is I would just pick one part of the preparation and and I would just do that only. And so I'd
Okay.
get a brand new tooth, and if I like for have you guys done class twos yet?
No, I think we're doing that in a couple weeks, but we're just finishing up. And I want to talk to you about this too, is indirect vision, but we're doing
Okay.
an occlusal lingual where we drop a box on the lingual side, but we haven't done class two.
Right. Okay. Yeah. So, but for class ones, like if I was having trouble doing, making my dovetail kind of
Right.
look really just how I wanted it, like smooth and making it round, I would get a brand new tooth and just do the dovetail part. And I would just do that over and over again until I got that how I wanted. And then I would like purposely make a really rough floor and like just practice smoothing that out with trying to use my instruments sometimes and then using the slow speed. I never got that to work, but yeah. So any part that I was struggling with, I would only focus on that part when I practiced.
Okay. Yeah, that's helpful. And that's something I like, that you kind of simulate different scenarios and then, you have to figure out how to fix it. I think that's a good tip.
Oh yeah,
Um,
on the practicals, if I mean something always goes wrong in the practicals. Like for me, whenever I start out, like the first 10 minutes, my hands are so shaky, and I'll like do a punch cut, and it'll go like a half a millimeter too deep, and then I'd have to learn how to fix it. And so if if you've never put yourself in those scenarios to fix your mistakes, then it's going to be really hard to do during the real practical.
yeah, absolutely. That's great advice. So now, what are your tips on indirect vision? Because that's something that, we're just starting to prep on maxillary teeth,
Mm-hmm.
and it's confusing at first to kind of
Yeah.
get your hands to do what you want them to do while looking into a mirror where everything's backward.
Yeah, I remember the first week I was doing maxillary. We were doing I think we were just doing an occlusal class one on number 3, and I like went to take the my burr out or my drill out, and I completely just jammed it right into the tooth, and like I would have pulped the tooth before for sure. I was like 4 millimeters deep, and I just like set my drill down and went to the bathroom like I just needed a break. But the only advice would be you just have to do it over and over and over again, and go really slow. Like pay attention to whether as you're going, like if your drill hand if you have like a desk grip on your drill. I felt like a lot of times I would just be super stressed out, and I'd realize like I was squeezing as hard as I possibly could for just because I was nervous, and then I'd relax, and then so that helped me. And then before you drill, I think it was nice. I wouldn't press down the rheostat so my drill wasn't spinning. kind of just trace the movement that you're about to do. And so you kind of see it in the mirror, and you kind of like your muscles learn, if you want to go left, you have to go right. And that just helped me.
Right. Yeah, that's helpful. It was really weird, actually, just the other day after I prepped while looking into the mirror. We have these little evaluation sheets for our preps, and I was evaluating, and all of a sudden my hands started going opposite, as if I was still looking into the mirror.
Yeah.
It was the
No kidding.
thing. Yeah.
That's a good sign, though. That's a good sign.
Well, we're going to start wrapping it up here, but before I let you go, do you have any final advice for dental students when it comes to either boards or, I'm putting you on the spot here a little bit, but either boards or clinical skills? Do you have any pieces of advice?
I think one of the most important things, and I learned this in undergrad, but even more so here, there's going to be you're going to have either bad practicals or bad tests or bad quizzes. And, I've been stressing out trying to get, the best possible GPA and class rank, so I can hopefully not close any doors to specializing. But I've gotten 40s on some quizzes, and I've gotten some 60s on tests and stuff. And even with that, you can always battle back. And so I think the biggest advice is don't give up. You can get a bad grade in something and still get an A or a B in a class. And I've seen some of my classmates, they do bad on something, and it kind of sucks their will to keep going back to the library or keep going back to the pre-clinic lab and practice the hand skills. But there's nothing that's irreversible, I guess. And so I think that'd be my biggest advice, would be to always just keep grinding out. It'll work out. I know at some point school can just overwhelm you and make it seem like it's impossible, but so many people get through it every year. It's definitely doable. And I think it's doable to not only pass, but to get through and have a bunch of fun at the same time. I think this is probably one of the most fun times in my entire life. I love my classmates. We just had our big winter formal. We call it Mandiball.
Okay.
It's our big dance that we have. We just had that this past weekend, and it was a ton of fun. So I'm super happy or grateful for the position that I am in life, that I'm in life, and anyone who is in dental school has all of those same things going for them. I think we're in an awesome career, and it's easy to lose sight of how fortunate we are when we're stuck in the library studying for hours and hours, and we don't actually see real patients yet. Kind of feels like we're not really making any headway, but I'm going to be done with classes in 3 months, which is scary as hell. But I'm excited to learn how to be a real doctor pretty soon.
Absolutely. It's very stressful, but exciting at the same time.
Yeah.
And we'll have to we'll check in with you again after you treat your first patient. We'll see how that experience went.
Yeah, that'll be a wild one. I feel bad for whoever it is. Hopefully it goes well. I've been trying to think about what my answer is going to be for my first patient when he asks me, have I ever done this before? And I'm like, yeah, I've practiced thousands of times. I just won't tell him it was on plastic teeth.
Right. Right. Absolutely. Well, Trevor, man, thanks so much for being on the show. I really appreciate you sharing your experience with the boards. And again, for all you listening, go check out Trevor West DDS on YouTube and Instagram, as well as I think he has links on his Instagram for Fine Balance too.
Yep, it's on it.
Awesome. So everybody go check that out. And thanks again for being on the show. I really appreciate it. And we'll catch up with you again soon.
Hey, thanks a million. Talk to you later.
Hey, take care.